If you're someone who's been dealing with pain on the outside of your elbow and it's limiting you from progressing in the gym, playing things like tennis or racquetball or pickleball, or just keeping you from doing the things that you love to do, well, you're in luck, because in today's video, we're going to be talking about some of the best things that you can do to help get rid of that elbow pain, as well as some considerations of where that pain might be coming from and the best ways to fix it. Hi, my name is Dr. Seidel. I hold a doctorate in physical therapy, and I've worked with all sorts of patients with a variety of different orthopedic conditions, ranging from athletes from the D1, NBA, NFL spaces, all the way down to the people who just want to get rid of that nagging knee pain when they walk. My whole purpose of this channel is to give you guys some of the practical tips, advice, and exercises that you guys can implement to not only rehab yourselves from the pain that you're feeling, but also make sure that pain never comes back. As always, I'll leave timestamps in the video description down below in case you guys want to jump around, grab the exercises, or just go to a certain spot that you guys want to watch. But I do recommend that you guys watch the full video so that you get an understanding of not only what's happening, but why it's happening, as this can be a very important part in not only rehabbing from the pain that you're currently feeling, but also preventing this from happening ever again. The whole motto here at EveryoneAthlete is exactly that. Everyone is an athlete, whether you're a professional athlete, an amateur athlete, a weekend warrior, or just someone who likes to lift weights or play some sports on occasion. Our bodies are made to move well and move efficiently, and when we can't do that, it starts pulling motion from other parts in our body, which leads to subsequent pain and injury. If you like this type of content and you want to break what seems like a never-ending cycle of injuries and setbacks in the gym and in your sports, make sure to like this video, subscribe to this channel, and ring that notification bell so that you get notified every time a video comes out. And the reason I ask you guys to do this is not just for me building up subscribers and me building up everything on YouTube, but it's also the best way to let YouTube know that my videos are helpful, so that way it shares my videos and this information with other people who are also in need of tips and information such as the one that I'm doing in this video. Without further ado, let's get into the video. So lateral epicondylitis, or pain on the outside of the elbow. It's a super common overuse injury that's typically seen in people who play racquetball sports such as tennis, pickleball, things like that. But it can also be present in people who just started a new gym routine or started to do a new exercise. Anything that is a new stimulus to the muscles and the tendons on the outside of the elbow. So lateral epicondylitis, it's inflammation of what we call the common extensor tendon on the outside of the elbow. All of your musculature of the backside of your wrist come in and attach in one area of your humerus or your upper arm bone called the lateral epicondyle, thus the name lateral epicondylitis, which the itis just means inflammation. Activities with repeated flexion and extension of the elbow, such as at the end or the beginning of a tennis swing, can put a lot of stress on this tendon and on this region. So there's a couple tests that we quickly have to do to make sure that the pain that you're feeling in your elbow is actually at your elbow and the muscles and the tendons at your elbow. Sometimes pain can come from the neck and it can refer down to the outside of the elbow. So for the first diagnostic thing that we have to do is, do you have neck pain or numbness or tingling down the arm? If the answer is yes to that question, it doesn't mean that it is coming from the neck, but it is something that you guys should get checked out by a doctor or a physical therapist to make sure that that's not happening and that the pain is truly on the outside of the wrist. So let's say you don't have any neck pain, you don't have any tingling or numbness into the hand or into the elbow at all. What you have to do is make a ball with your fist, straighten out your elbow, and you'll want to overpressure and stretch it into wrist flexion so that you are bending your wrist forward. That should cause some pain at the elbow if you're having true lateral epicondylitis. Now, if this test is positive too, then this next one should also be pretty positive. In this same position, now what you're going to do is you are going to try to pull your wrist up into extension, and you're going to resist that with your other hand so that you don't move. Again, you should feel pain in the same part of the elbow, right on the outside of the elbow, kind of near where your bicep inserts. Another test that you guys can do is a resisted middle finger extension, or literally just sticking out your middle finger. You'll close up your whole hand, stick out just the middle finger, and you are going to try to push down with your other hand on that finger, and the whole point of it is to elicit some pain on the outside of the elbow as well. Okay, so the tests were positive, meaning you had pain with those things. So what can we do to get rid of that pain and then build yourself back up so that you don't get it in the future? The first thing we have to think about is that, again, this is a overuse injury, which means that you've used the tendon either too much or too quickly without proper exercise or warm-ups. And so the first thing we have to do, in addition to these exercises that I'm going to give you, is you have to stop doing the activity that causes your pain. Now, I'm not saying that you have to completely stop doing the exercise that you like to do. What I am saying is, if playing 10 minutes of tennis causes your elbow pain, limit it to 5 minutes. We have to do this in order to decrease the inflammatory process that's happening in the tendon of the elbow, so that we can calm everything down, and then with the exercises that we have, build it back up the right way so that your tendon becomes strong and it's more resistive to these forces that you put on it while playing sports. So when looking at what exercises and what body parts we can strengthen to not only rehab from this, but also prevent the pain from coming back, we have to consider the whole arm as what we call a kinetic chain. Each link of the chain, or each joint, so the wrist, the elbow, the shoulder blade, and even the back, are all parts of this chain, and they all have to be strong in order for your body to produce and control movements effectively. Now, if one part of this kinetic chain isn't strong, the other parts of this kinetic chain, or the other muscles and joints, have to overwork to compensate for that weak part. And so even if you don't have necessarily a change in exercise intensity, if you have a weakness in a part of one of these chains or joints, then that can also lead to a overuse injury, even though you're not really changing anything up. Okay, so we got to the exercise portion of the video, but really quick, I want to remind you guys that if you guys like this video, you like this type of content, you learn something new, make sure to like the video, subscribe to the channel so that you guys continue learning how to rehab your body and prevent injuries in the future. So without further ado, let's get into these exercises. Let's work our way up the chain, starting with the wrist, and then we'll end with the shoulder blade and the back. The first exercise on this list is called eccentric wrist extensions, with eccentric meaning you are only lowering the weight in this movement. You want to start by propping up your arm on a bench, a table, or a chair with your wrists off the side in the air. While holding a band or a weight, use your other hand to passively raise your wrist, then remove the hand and slowly lower on your own. Make sure to perform the lowering portion only, as this is the most beneficial in stimulating new tissue growth and healing your tendons. This can be done for sets of 10 to 15 reps for no more than 2 to 3 sets at a time to prevent aggravation of your symptoms. Moving on to the elbow, we have an exercise that you all are probably familiar with, and this is called hammer curls. You're going to want to grab a dumbbell or a cable or even some bands, and you're going to want to keep your wrists neutral. So not supinated and not pronated, but neutral. You're going to just perform this like a regular bicep curl. You're going to curl up and curl down. With this one, in addition to hitting all of the elbow flexors, or the muscles that bend the elbow, we're going to be targeting in on a muscle called the brachioradialis, which it is a elbow flexor, but it does attach to the extensor side of the arm. And so this can be one of the pain generating muscles and tendons. And so we want to make sure we work it. Typically for hammer curls, we can go pretty heavy, but because you're having pain, we want to start off relatively light, but eventually we want to build up to the point where we're doing heavy sets of around 8 reps for, again, 2 to 3 sets. Make sure to not overdo this one, as it does attach to that common site. And again, you don't want to aggravate your symptoms. Moving on to the shoulder. This is probably one of the most important joints for you guys to exercise properly and make sure that you guys are doing the exercises and stabilizing and strengthening this joint, as it's a super mobile joint and it tends to pick up all of the extra motion that are lacking in other joints. And so it's very prone to injury and it's very prone to overuse. The first exercise we're going to be starting off with is called external rotation in neutral. With this, you can use a band or a cable. You want to make sure you're not using a dumbbell in this position, as that's not really going to provide any kind of resistance to the rotator cuff. The muscle we want to hit here is a small rotator cuff muscle called the infraspinatus. Now, because this is a small muscle and a small stabilizer of the shoulder, we want to make sure that you're not going very heavy. This is meant to be an activation exercise only, and so we're doing about 10 to 15 reps on average, but you can go as high as 20 on this one. And this is meant more of an activation and a light strengthening than a hardcore set. You want to make sure that your elbow is locked in at 90 degrees throughout this whole movement, so that the only movement is coming from the shoulder as a rotational movement and not any kind of movement at the elbow. Again, our focus is at the shoulder, so you should be feeling this in the back of your shoulder and not anywhere else. Lastly, we have what we call D2 shoulder flexion, or really it's a D2 pattern, we call it. The muscle we're trying to hit here is the lower trapezius muscle, or the lower portion of the trapezius muscle. This muscle is responsible for pulling your shoulder blades down and back, but it also controls the shoulder blade from going up and forward when you're doing a throwing or a hitting motion. What you want to do here is you're going to grab a band or a cable, making sure to keep the elbow straight this time and not bent, and you're going to pull your arm straight up in a Y pattern, so about 45 degrees out to the side, like you're doing a Y in the YMCA. Again, because we're targeting a back muscle, you're going to want to try to think about pulling the shoulder blades down and back as you do this, so that you feel that muscle properly activating. This can be a hard muscle to feel, so if you don't feel it for the first couple of times or even the first couple weeks or so, don't be discouraged. It took me a while to get it, but you'll eventually get it, and I promise you it'll help with shoulder or elbow pain as well. Because this is a small portion of the muscle, we want to make sure that, again, this is an activation and a light strengthening exercise. So we want to stick to reps of about 10 to 15 repetitions, making sure that you're doing it properly and not bending the elbow or not compensating any kind of way. So there you have it. Some of the best exercises for that kinetic chain that you guys can implement today into your workout routine to not only get rid of that nagging elbow pain, but also prevent it from coming back entirely. Here's a list of the exercises that we did in this video. Feel free to pause it so that you can screenshot it and refer to it back whenever you need it, or just download it to your phone or anything like that. Like I said before, you guys can exercise all you want and you can implement these exercises every single day. But if you're not taking appropriate time to rest and avoid the painful activity, your pain really is never going to go away, as you're not allowing appropriate time for the tendons and muscles to heal like they need to. My goal with this channel as a practicing physical therapist, as a lifter, and as a former college athlete is to cover the best rehab techniques for common injuries that you guys might have, as well as optimizing performance for different movement patterns and different joints of the body. I want to take all the knowledge and experience that I gained as an athlete and as a lifter and pair it with 7 years of study and professional practice as a physical therapist and put it all together in these videos so that you guys get the best of both worlds. So if you like this video, you like this type of content, and you want to keep learning some strategies on how to move pain-free and how to keep progressing in the gym and in your sports without having injuries and setbacks, make sure you guys like this video, subscribe to this channel, and put down in the comments if you guys have any injuries or any topics that you'd like me to cover. Thank you guys so much for watching. I'll see you guys in the next video. Come on! This is an easy concept.